Hi everyone, my name is Dr. Ebe Adebuto Ajay. I'm the TheNaijaOncologist, and in this video we'll be discussing symptoms of colorectal cancer. I mean, how do patients who have colorectal cancer, how they present in the hospital? There are two broad categories of these patients. One, those who don't have any symptoms at all, and those who have symptoms. But for the purpose of this video, we'll be discussing those who don't have any symptoms at all. So what we're saying is this. For example, you visit a surgeon or a gastroenterologist for a medical check, and he passes a tube through the anus into the colon to view the environment of the colon. Two things, among others, can be found. One is a polyp. A polyp is an outgrowth within the lumen of the colon and shoots outside. Now that polyp could be there for donkey years, 10, 20 years, but eventually, most of the time, that polyp is what we call the pre-invasive stage of a colorectal cancer. Now, what that means is that that polyp could eventually translate into a frank lesion that could be responsible for colorectal cancer. There could be other lesions that could be detected within the lumen of the colon. It could be a small ulcer, or it could be a bleeding vessel. Usually, these lesions don't give the patient any complaints or any bother. That is why they are the asymptomatic group. And you just discover that as time goes by, 10, 20, 15 years, or even as short as 5 years, they may now come down with the disease. All of this is embodied into the concept of colorectal cancer screening. And what we just described is what we call a colonoscopy. So who are those who should go for a colonoscopy examination? There are two groups of people who should go for a colonoscopy examination. One is the average risk persons. These average risk persons are those who, one, don't have a history of colorectal cancer, they don't have a family history of colorectal cancer, they don't have any history of a polyp or an adenomatous growth within the intestine, neither do they have what we call inflammatory bowel disorders. Now, this group of people are the average risk group of individuals. The other group of individuals are the high risk individuals. These individuals have those things that the average risk individuals don't have. In the process of screening, the average risk individual should start his or her screening at age 45 to 50, and that colonoscopy is done every 10 years. Now you ask me, aside from a colonoscopy, what other tests can be done? There are fecal occult blood tests and there are other immunologic tests, but the gold standard is the colonoscopy examination that is done. And when the doctor does that colonoscopy, he will see the lesion, he will pick out of the lesion, and he will test the lesion. High risk individual, you could start your testing at the age of 40 or 10 years before a family member was diagnosed. At the age before the family member was diagnosed, you run your colonoscopy every 5 years. Now, the benefit of this screening is to make sure that the disease is detected as early as possible and treatment can be instituted. And that way, we can say that yes, colorectal cancer can be cured. Thank you for your time. I want to please ask that you follow, like, and share this video. Join me next time as we discuss cases that present with symptoms.